Unfortunately, we know that if patients are not compliant with both the lifestyle modifications and medications in the setting of high cholesterol, that they are at an increased risk of several problems. They're at an increased risk of heart attacks and strokes, and therefore it's imperative that patients stay as compliant as possible to decrease those risks. If somebody's having trouble sticking to their treatment plan, there are a couple things they should do. The first is they should come up with a system that makes sense for them. Do they have everything written out? Do they have a buddy in the process, a family member, a friend, who they can rely on to help support them through the changes? Second thing they should do is they should feel comfortable talking to their doctor about these challenges. Not be afraid to bring it up. You're not failing if you're not compliant and talk to your doctor. The failure comes when you keep it to yourself and have a negative outcome because of it. I encourage people to go over their medication list at every visit with their doctor and have a discussion of what the benefits are to each of the medications to see if any can change. Unfortunately, we know from years of research that lifestyle modification is really tough. Weight loss, for example, has been shown in a good number of people to have rapid weight loss initially, but inability to sustain it over time. We know that there's a high relapse rate when people stop smoking of going back. What I tell my patients when I see them and they've had a slip back on a lifestyle modification is that we're looking at a long-term goal. I never get upset with them for gaining back weight or starting smoking again, but rather the goal is to be supportive, to start again, and to be successful that time. For lifestyle modification, I'm a big fan of logs. Write it down when you're exercising so you can see that you're hitting your goals for a particular day or week. Writing down what you're eating. Sharing your log with a loved one, family member or a friend who's supportive in your goals of changing your lifestyle. When it comes to medications, compliance is really difficult. I am a fan of people using the alarms on their phone to remind them to take medications. I think when it comes to a plan of lifestyle modifications, first, it's not a one-size-fits-all. And second, it's not a complete lifestyle modification of all factors at one time. I think you should be coming up with a plan with your doctor, with the team in their office, to talk about what steps you're going to make between that visit and the next visit. Make achievable goals for yourself, and you're more likely to be successful than if you say you're going to change your world in one day.